Hello, today I will be presenting the cycles approach. The cycles approach is an evidence-based way to treat phonological disorders in children. First, we'll start with the goals category. What are the goals of the cycles approach? And in that category, we will start with for whom and for what. For whom, the answer to that would be children with highly unintelligible speech. The precise definition of highly unintelligible would be less than 20% intelligibility. It would be severe to profound phonological impairments guided by that measurement. The goal of this treatment is to expedite intelligibility gains in time for school success, because high unintelligibility upon entering school leads to excessive difficulty with reading and writing, and that can lead to a downward spiral throughout the school years. So this is something that we want to target early on in kids at a certain point before they start their schooling. Then what is the focus? The focus of the cycles approach is phonological patterns. So for example, prevocalic K, so carrot, car, or perhaps the S consonant clusters. Stimulable sounds are targeted. What does that mean? It means that in the cycles approach, we would target sounds which the child can correctly mimic. Why? Because a child is more likely to have greater gains with this foundation of mimicability, aka stimulability. And that's exactly what we want to do, is for them to have maximum gains before that school age. The goal characteristics. What do the goals look like? We are targeting phonological patterns, so like S consonant clusters or velars, certain sounds and word positions. Obviously, this should probably go without saying, but dialectal and cultural differences are not to be targeted. If pronunciation is different from the norm because of dialect or because of those cultural differences, that's not something that we're trying to quote unquote fix. And the complexity of targets is equal to what is typical at that age. So you need to ascertain what sounds are typical for that exact age group, for that child that you are working with. You can look here, there's this little graphic for the zone of proximal development, is another good guide. In the center is what the learner can do unaided without the help of the clinician or whoever is speaking with the child. The outermost white circle is what the learner cannot do, and we want to hone in on the middle light blue circle in between, which is the zone of proximal development, where the child can do something but needs guidance. Remember that point about stimulability and being able to mimic, at least some of the time, whatever sound the clinician is making. Then there are the linguistic contexts. Stimulable sounds are targeted, like I said. We would use real words, such as, to give an example, prevocalic k. We could use carrot or car. You would have slight amplification of those target words. And you would also aim to encourage metaphonological awareness, for instance, with rhymes. There is more than one goal in the cycles approach, and these different goals are the different types of patterns that you're trying to treat. Each pattern is treated cyclically, and there are 60 minutes per pattern. This could be divided up into 2 sessions of 20 minutes, or it could be a whole session of 60 minutes, etc. And it's a total of 60 minutes per week, typically. And then the patterns are recycled as needed until they arise in conversation. So you reapply the cyclical steps until the correct versions of those patterns become the norm. Now for the teaching moment. Let's say, for example, that the word initial k is consistently fronted. So, for instance, in trying to pronounce carrot, the child says tarot. There are three parts to the teaching moment: antecedent, response, and consequence. A possible antecedent would be the clinician saying, "Repeat after me. The parrot ate a carrot." The target word here is carrot, and here the clinician would be aiding metaphonological awareness with the rhyme. Then the child would repeat, that would be the response, and based off of whether the response is correct or incorrect regarding the target word, then there would be a consequence, namely, would you repeat this step, or would you move on to the next thing? Models would include practice words, for instance, cookie, carrot in our example of prevocalic, and written usually with images. And like I said, you need to probably do things like encourage metaphonological awareness with a rhyme: parrot, carrot, the parrot ate the carrot. And this is a carrot parrot, and that's another carrot parrot. Our modality is auditory stimulation with slight amplification, so it's auditory based. The child's response, let's see, the clinician might say, I had to carry some dairy. That should be switched around a bit, but never mind. I had to carry some, or I had dairy to carry, as you can see at the bottom there. I had dairy to carry. So then the child would repeat and try to fill in the target word when blank. This is an example of something that could be done within this cycle. I had dairy to carry. I had dairy to, and then the child could try to repeat that and we could focus on the target word that way. Feedback could include repeating that listening activity or any listening activity that might be similar that you're implementing. Also, caregivers and educators can get involved outside of these sessions. For instance, at the suggestion of the SLP, they can implement 2-minute exercises to have the child name the picture or repeat the rhyme with the targeted word. Now on to the context of the cycles approach. Who is certified to implement this approach? That would, of course, be a certified speech-language pathologist. And like I said in the last slide, caregivers and school staff can help support at the prompting of the speech-language pathologists with creative, short lessons that would reinforce the learning of these target words. Where because the cycles approach does have a bit of not a time constraint, it's a reverse time constraint. It could last for quite some time, 60 minutes per cycle, 1 cycle per week. That's the typical format. So school, it would probably be difficult to fit in a session like that. I'm not saying it's impossible, but typically it would be clinical or perhaps at home. This is typically individual, but it can be adapted to groups. Usually it's adapted to groups when the patient has gone from severe to profound speech to mild or moderate. At that point, oftentimes they could be considered fit for group therapy and stuff like this because they're a bit more intelligible. Resources needed would include toys, playthings. There's a carrot toy right there. Flashcards for the words, typically with images on them as well. And then in the upper right, that's an amplification device to use for the targeted words. The environment for the cycles approach ought to be enjoyable and spontaneous. You want to encourage the naturality of these responses, and you want it to flow over into their typical experience and into their daily lives. And then on to the procedural issues. In terms of intensity, each phoneme in a pattern gets, like I said, 60 minutes a week, and it can be divided into, say, 3 20-minute sessions. I think I might have said 2 20-minute sessions, but it would be 3 20-minute sessions, maybe 2 half-hour sessions. And the patterns would be recycled as needed in order to hone in on those target words and to cause them to arise in typical conversation. Something to keep in mind is that when you're dealing with cognitive delays in the patient, that might mean that it could go up to double the time for each session. So instead of 60 minutes a week, it could go all the way up to 120 minutes per week. In terms of training before implementing the cycles approach, you would need to be a certified speech-language pathologist. And then the speech-language pathologist would present additional supplementary activities, most likely designed by the SLP, to parents and caregivers and educators, which would match the targeted pattern. In terms of the sequence, it's typically 3 to 4 cycles total, so about 30 to 40 hours total. 1 total hour per week for each pattern. Here's an image of a type of the cycles approach. You go from reviewing whatever patterns ought to be targeted. Start at the top there with review. Auditory bombardment, so you would bombard them with the relevant sound. Then you go on to practice words, activities that elicit those words, metaphorological activities such as rhymes, like I illustrated before. And you would probe to find more things to target, more auditory bombardment, and then home practice, like I have mentioned a few times, and then back to the review. The evaluation would be made by a speech-language pathologist before and after each cycle, and it would be a standardized evaluation. The tool that you would need for that is called the HAP3. That stands for Hodson Assessment of Phonological Patterns, the 3rd edition. It's a valid standardized test for this type of thing, and it's designed for children with highly unintelligible speech, which is exactly the clientele that the cycles approach focuses on. These are my resources. Number 1 and number 3 are both from ASHA, and the second one is from the National Library of Medicine. And that is it for my presentation. Thank you for listening.